Within the medical applications, we'll see two different techniques. One is therapeutic techniques and then diagnostic techniques. First, let's look at the therapeutic techniques for using radioactive materials. Cancer treatment is probably the first thing that comes to mind. You will use gamma or beta radiation to stop cell growth. And that can be targeted, or it can be like a whole brain therapy, or like target a certain part of the body. We use some external devices, gamma emitters, such as a gamma emitter would be like cobalt 90. Cobalt 90 has a really big nucleus, so when you get a big nucleus, it has a lot of neutrons in it, much more than you would normally find in cobalt. It makes the nucleus really big, and when your nucleus is really big, that strong nuclear force just can't hold that nucleus together, because the strong nuclear force only is only effective over very small distances. So that atom becomes unstable and radioactive. So we use these gamma emitters. These can be very targeted, the cobalt 90 for example, and such things as a gamma knife. These are like brand names of these devices, where they use multiple beams with low intensity. I have a video that I want you to watch about one of these. I forget which it is, gamma knife or cyber knife, but they operate similarly. But say this is your head. Well, that's a strange looking head. But say you have a tumor right here, and you want to target it. So you use your cobalt 90, and you send in a ray of gamma rays, like a thin beam of gamma rays at low intensity, and they go into that tumor. And then you go around and you do it all around, so you have these multiple beams that are all targeted at this central point. And when you have those targeted at the central point, you can kill the tumor, kill the cells that make up the tumor through this gamma radiation. There are also internal devices that you can use, brachytherapy, implants. Radioactive materials in the form of beads or small implants in or near a tumor. So we actually go in and surgically implant these into the tumor. This is useful because the radiation is chosen such that it doesn't travel very far outside of the tumor, so it's targeted, you have it there, and then it's able to slow or stop the growth of the tumor. Radioimmunotherapy. Or RIT. In this, you have a drug that is tagged with a radioisotope. So like you have your molecule, I don't know what it's going to look like. Well, let's say this is your molecule. And then you have a radioactive atom, nucleus, that is wrapped up inside of that drug. You send the drug, it goes to wherever it's designed to go to in the body, and then when it gets there, it releases that radioactive material to treat whatever's going on in that organ, the tumor or whatever. I have a video that I want you to watch about this that's fairly interesting, where it shows a simulation of how these radioisotopes are used to slow or even kill a tumor. We can also use, for therapeutic techniques, we can use radioactive materials for pain treatment. Palliative agents, meaning for the reduction of pain, such as strontium-98 and samarium-153. You can use beta emitters that relieve pain due to bone disease. So sometimes your radiation therapy will be really only for the abatement of pain. And then finally, heart disease. We talked about in a previous chapter about balloon angioplasty. That's where you put a balloon into the artery and you inflate it so it opens up that artery. And then after you do that, you will place a stent inside of the artery. Remember, the stent was this metal mesh that's used to expand and then fill up the artery so that it keeps it open. It's kind of like a mesh hose. You put it inside the artery and it fills out the artery and keeps it from closing down again. However, often if you have an artery, so you have your artery and then you place your stent along the inside of the artery, and it's like this mesh that goes through the artery and holds it open. Often what you'll get is that you'll get plaque buildup on the ends of the artery, on the ends of the stent, and they'll eventually just fill up the whole thing so that you have the same problem that you did before. That is called stenosis. And sometimes you'll take a radioisotope at the end of the stent, embedded in the mesh, the metal of the mesh. Oh, that's not right. At the end of the stent can prevent plaque from forming and the arteries from closing. Okay, so you'll put these radioisotopes down here. They'll emit gamma or beta, and they'll keep this plaque from forming, so they'll hold back that plaque and preventing stenosis.